Hello, this is Chris Bolwage, and welcome to another edition of Our City. First of all, the only thing that we're talking about these days mostly is COVID-19 and our ability to get vaccines in people's arms. Please register at ucnjvaccine.org for Kean University or the Peterstown Community Center. And now you can call 908-820-4250 for a registration, or you can even walk in. We would prefer that you make an appointment. There are plenty of vaccines available, so please get vaccinated. If you are 18 and above, you are eligible for the Moderna vaccine, 16 and above for the Pfizer vaccine. We also have Johnson & Johnson vaccine that we are giving to shut-ins and people who cannot leave the home, as well as the homeless population that can get one shot. You can also register at the CVS Pharmacy. Availability is at cvs.com or at Stop and Shop, which is stopandshop.com/COVID-vaccine. You can register on the state website at covidvaccine.nj.org for Trinitas Regional Medical Center or ShopRite and other locations. COVID-19 testing is still happening, and we need to keep testing in order to beat back this virus. We have all of that information in our Public Information Office or in the City of Elizabeth Health and Human Services Department. It's free. The X-Laven Recreation Center on Tuesdays and Thursdays during May from 3 to 7 p.m. and Saturdays 10 a.m. to 3 p.m. and also the Stephen Sampson Center on Mondays and Wednesdays from 5 to 8 p.m. So it's not only important to get your vaccine, but if you have any symptoms, please get tested. An appointment is not necessary, insurance is not required, but we do ask that you have a health insurance. Please bring it, and a proof of ID, a photo is requested. Drive-through testing is available at Kean University on Mondays from 8 a.m. to 12 p.m. and Thursdays 8:30 to 12 p.m. You can book an appointment at ucnj.org/COVID-19 or just call 908-214-7107. Even with all of the vaccines and the testing, and even though the numbers are coming way down, like this past weekend, we only had 42 new cases and 0 deaths. That's the lowest we've had in almost 9 months. But we can't give up. We must continue to follow the social distance rules. We must wear face masks when we're in public or in large groups, and we must continue to wash our hands frequently. If you missed any of these numbers or information, just call our Public Information Office at 908-820-4124, and they can follow up with you. Now, every year we do a show in the studio here in City Hall in the back of City Council chambers, and we usually have guests. We're doing Zoom, and I'm pleased to say that the Historical Society has agreed to come on via Zoom. We have the president of the Historical Society, Ms. Ceal Mantilla, joining us. We also have Michael Simon, Esquire, who is the co-secretary for the Historical Society of Elizabeth, and Dr. Craig Donovan, a professor at Kean University. Ladies and gentlemen, welcome to the show.
Welcome, Mr. Mayor.
Good to see all of you. I wish we could be together, and hopefully next year we'll be able to do that. So who do you want to start with? Ceal, you want to start with? You got the lengthiest resume.
Oh.
Ceal,
Okay.
Ceal, tell us about yourself, Ceal. You've been active in our Board of Education and historical, lots of things. Tell us.
You know all about me. You want me to still tell?
Sure, I want you to tell. Come on.
Okay. I just want to say that I lived all my life, born and raised here in Elizabeth, went through the school system, got my Master's of Social Work degree at Fordham University, worked for the state of New Jersey for a number of years, and then later came on to work for the Board of Education as a social worker for 35 years. So I've been here a long time, and I feel like I'm a historic person right here in the
Ceal, even though you're retired, Ceal, you put in a lot more time now than you did before, right?
You're telling me. You're telling me. I also served on 15 years at the YWCA, working with women with domestic violence. So I've been a very happy camper. I'm a very busy little bee, and I like being that way. So it's been kind of hard for me to get used to being at home, isolated, but I guess we all have to do it. And I'm still here and still alive, thank God.
Well, we thank you for your work with the Historical Society, and we're going to get back to you in a minute. Michael, you're an attorney. You grew up maybe in Elizabeth, but your family did. So tell us about yourself.
I grew up in Elizabeth as well. I grew up in Elmora on Wyoming Avenue, right off Elmora Avenue. I went to St. Jen's Grammar School from kindergarten through 8th grade. And I lived in Elizabeth until my late 20s. And a lot of my legal work is done in the city of Elizabeth. And about 10 years ago or so, I was fortunate enough to come across the Historical Society and joined the Historical Society, where I participated in numerous forums and research throughout the years. Currently, I practice criminal defense work and civil litigation at my law firm, the Donald A. DeGioia Law Group in Mountainside.
Well, Michael, it's good to see you again. And you also got a couple of kids since we spoke last, right?
Yeah, I have a couple kids. They're getting older now. But the pandemic was certainly challenging. They're in second and fourth grade. Zoom schooling wasn't ideal, certainly not from a parent's perspective, but we've managed, and they're getting back into the classroom, and it's really good to see.
We all have a newfound respect for teachers.
Absolutely.
Which leads me to my next guest, Dr. Craig Donovan, a teacher over at Kean University. Even though I never had you as a professor, Dr. Donovan, I've known you over there at Kean, not only for your work with the Historical Society, but Future City and Environmental Day. So tell us a little bit about yourself, too.
Well, I'm actually from California. I was born and raised there. First in my family to go to school. I got my undergraduate degrees at the University of California, a master's at San Francisco, and dual doctorates at the University of Washington, Seattle, which leads me to becoming dangerously overeducated, as my students would say. But I've spent the last 30 years in New Jersey teaching at Kean University. I teach public and nonprofit management. I was in charge of policy for the Public Policy Center of New Jersey in Trenton. And I've done policy work for local, state, and the federal government for almost 4 decades now.
Well, we appreciate your work here, especially all of your volunteer hours in the city of Elizabeth. And I'm going to go back to you, Seal and Michael, and tell us about the Historical Society and basically how's it going, what you're doing, and kind of give an overview of the Historical Society. Seal, we'll start with you.
Well, I think we're doing very well. We're continuing to maintain our houses, but more importantly than that, we're continuing with our researching the historical narrative and also passing it out to the community. And we do that through our annual forum. We do that with the Hispanic diaspora. We do it through environmental, and Future City does it through Environmental Day. So we are doing very well, and we continue to do that and want to continue to do that and pass on the information and how important history is, not only to the present, the past, and the future. And we just have to give this out to our community.
Thank you. And Michael, you're located in Bonnell Hall right now, which is the oldest structure in the city of Elizabeth, built in the late 1600s originally. Is that where the Historical Society is located? Can you talk to us about that?
Yes, Mayor, it is. This building is occupied by the Historical Society. We have our own suite here, a room which we're doing the interview from here today. We have our pre-pandemic. We had a lot of our meetings here. We store our research and things like that. It's also the home of Future City, which is another nonprofit group, environmentally based, where students work on various projects, environmental projects throughout the city. So we work together on many projects together, and also on maintaining the house. which is, as you mentioned, very old, but in very good condition. You know, it has electricity, running water. We have, you know, central air in here, and we've adapted it for our present use. So the history of the house lives on.
So we're about to enter into a Elizabeth Forum, and the Historical Society conducts these forums. I know, Mike, you've been involved in them. Dr. Donovan, I believe you've been involved in them, and Seal. So what is the Elizabeth Forum? Tell our viewers what that is, and why is it important to conduct them? Greg, you want to kick that off?
Actually, the forum was my first introduction into Historical Society. I believe in 2010 or thereabouts, Dr. Paul Mattingly, the then president, was doing a research project on Bay Way. And I inquired and helped volunteer with that project about the history of that neighborhood, different immigrant populations that have come and gone, and the changes throughout that neighborhood, and where the industries were, where the shops, the stores, how people lived. And the forums throughout our work here have covered various different neighborhoods, and now we've gone into different topics. You know, we did the memorials in Monument Park across from City Hall, sorry. And this year we're focusing on the pandemic, but it is the major research project we do throughout the year to help educate and inspire people to think more about the city's history.
Craig, I haven't gotten you involved yet, and I wanted to. You're a professor. Tell me, can you use these oral histories as a teaching tool for students coming through an education process at Kean University?
Oh, absolutely. I think they're critical. And, you know, the blessing of the technology is that it's easier today than ever to make these kinds of oral histories. The equipment's more portable. It's a much higher quality product. And so it's an opportunity to save and preserve this history for the generations to come. So it's an invaluable teaching tool, and one that the internet and other things have just made so much more available to so many people anywhere in the world.
What is the title, Mike and Seal, of this year's forum?
It's intersections, the pandemic, historical intersections, pandemic 2020 through 2021.
It's probably going to be a lot of information in one subject area, correct?
Absolutely. You know, the word intersection, you know, just like a cross street, it's where 2 points meet. And certainly in March, early March of last year, you know, everyone, where no matter where you worked or went to school, hit the pandemic intersection and was forced to adapt your life and find ways to continue to be productive and thrive and work. And so this forum touches upon some of the different industries and different work and education and the problems people face.
Yeah. Well, COVID has invaded every part of our lives, economically, financially, socially. So it has affected everybody. And that's why we think it's such an important topic to bring to the attention of students, and how it really has affected many, many things, and how we've been ingenious enough to adapt to it, even though it's been difficult, but we've done pretty well adapting to what we had to. And we've never experienced anything like this, not even in my lifetime, which has been a very long life. I've never experienced anything like this because of the way it has infected everybody. Polio, yes, was infectious, but not as much as this. He seemed to hit every aspect of life. And this is a totally different way.
So Seal, since you mentioned your years of longevity, I would imagine your parents would have lived through the 1919 and 1920 Spanish flu episode.
Yes, they did. But I was only about 10 years old at the time. So I didn't know what was going on. We didn't have the kinds of things that we have now where we can get the information out to young people. So that's why our organization feels that these forums are very important because we give out information on numerous things that have happened in our city and in our country. And it's very important how they impact us even today and what we need to do to avoid having the same thing happen later on, that we would be prepared. As Dr. Donovan says, it's important that we be prepared all the time. And I don't think anybody was aware of that until the enormity of this virus hit us.
So, Dr. Donovan, Seal just raised your name. What do you think, from a college perspective, that the audience should know about the city and region regarding the importance historically of public and civic health?
Well, I think three things, and that's why the title is so important. This is not the first public health crisis we've had, and it won't be the last one. My great-grandfather was killed by the Spanish flu. He worked on the railroad. People came through the town. He died at a very early age and left my great-grandmother a widow in her early 20s with 2 young children. We had a bubonic plague here in the New York metropolitan area that included the northern parts of New Jersey in the 1920s. My father-in-law was one of the last adults to get polio in the 1950s and spent the rest of his life needing assistance to breathe. So our country's been through some very, very important times when it comes to public health crisis, but we've gotten complacent and we've allowed ourselves to forget about that. We put a man on the moon. We had childhood immunizations. And it just seemed like it was a thing of the past that we didn't have to worry about it. And that isn't the case today. And so this region in particular, which is so tightly linked to the globe. I mean, somebody can get on an airplane halfway around the world, step off in Newark, and 60 minutes later be in downtown Elizabeth. You've got ships from ports all across the globe unloading in Elizabeth. And so what happens anywhere in the world can and will affect what's going on right here where we are. And so we've got to do a better job of being aware of what's happened in the past and being prepared for what has happened now and is going to happen again in the future.
So we're now in 2021 and the forum preparation and research. What relates to today in 2021 in our city and region, Mike?
Well, in terms of a historical perspective, when the Spanish flu was raging, Elizabeth had a very large population. So there is a blueprint to look at as to how to treat it today. But the whole thing with the history of Elizabeth is that it really has touched upon every period in our American history. So since our history is so rich and there's so much to look into, so much research, we can often use that as a guide to any problems that we face today.
So, you and Craig just raised some good points, and especially over the last 40 years, I guess with HIV and MERS and SARS and the other possible epidemics, they were relatively controlled and not spread throughout the population the way COVID-19 has spread. And the lackadaisical attitude, also politics played a role for the first time ever in a pandemic. Is there a way that the country, you think, can get united in the future pandemics? Or do you think that barn door is open and never going to get closed? Craig, what do you think? You've been around teaching. I'm sure some of the students raise these questions.
Oh, absolutely. I think that we see that there are some leaders on both sides of the political aisle who recognize, the value of science and following the science. And we have to hope that the current anti-science attitude that a lot of politicians have espoused is a temporary thing. Because for all intents and purposes, we've been very lucky with COVID. We got a handle on it relatively early. We were able to develop treatments for it that reduced the death rate significantly. And yet the next COVID is out there. It's waiting. I mean, if you want to see when politicians make bad choices, look at what's going on in India right now. So, you know, we've got to expect and hope and hold our leaders to doing better in the future. We've been very fortunate. I think that New England, the Mid-Atlantic states, New York, New Jersey, Connecticut have some of the lowest infection rates, have some of the quickest response rates, the highest vaccination rates, and we're very comfortable in this part of the country, much more so than they are, let's say, in the South or in the Southeast. So we've come a long way, but it is a scary time. And this is why our students are so important, because they're the leaders of tomorrow. They're the ones that have to be prepared for the next crisis that's going to come along in 10 or 20 years.
Seal, you've worked with students for a long time. Do you think their attention span is critical in understanding this forum and getting the word to them so the mistakes of 2020 are not repeated?
Oh, yes, yes. It is important that the students, you know, stay focused and really understand the severity of this, because that's what my concern is, the way it hit everybody worldwide and the massive deaths. I'm not sure about how many deaths occurred in the Spanish flu, but I have just been shocked by the way it just enveloped the whole world. And it definitely has to be that the young people have to stay focused. They have to understand that this is a serious thing, and that unless they keep on it and unless they try to improve ways that we can all work together, it's not going to happen.
It's Seal, from what I read, it was 50 million people worldwide were killed in the Spanish flu. And keep in mind, that was also during World War I, so there were probably a lot of people killed in World War I from the flu that we just didn't know. It was substantially more than what's happened here so far. Mike, legally, where do you see it going with, you know, telling people that if you want to come back to work or you want to go to school, you have to get vaccinated? What are your thoughts on that?
That's an interesting point, and it's an interesting problem because, as you said, many people politicize this issue. But for example, mask wearing is not a political issue. It's an issue of science and the best data we have available. Same goes for vaccinations as well. So I think we really have to understand, and my aspect of the forum will be the legal aspect. The courts in New Jersey are really trying hard to open, because there are people awaiting trial. There are people in custody awaiting trial. There are people who need to confront the witnesses against them. That's a Sixth Amendment right, through their lawyer, through cross-examination. But you can't really do that over Zoom effectively. We do well with Zoom in the courts and in the legal field, with conferences, agreements, seeing each other face to face and handling those issues. But the real issue of rights would be having someone have their trial in person. So I think people have to accept these things and accept that there are people whose rights need to be protected, and you have to look at your citizenship not only as what I can do for myself, but what can I do for others? How can I get my company back open? I think legally people will be able to restrict people from entering the building if they haven't gotten vaccinated. It's necessary to reopen. There's a greater good, and the science has shown that vaccinations, mask wearing, social distancing, all these measures make a big difference. And we have to do this for citizens, in the legal field whose rights are being compromised right now because we can't get jurors in the building to hear their cases. So I think there has to be, the education component is important, and people have to recognize what their civic duty is.
So, Craig, in a closing note, you're going to go back to school in September. What kind of precautions you going to take? What are you going to do?
Well, the president, Dr. Lamont Repollet, just recently announced that they will be requiring all faculty, staff, and students to be vaccinated to come back on campus, which I think is a great thing. In terms of campus safety, we've improved the ventilation in all of our buildings. We've upgraded the ventilation systems. We've upgraded the filtration of systems. And I can see that, that we moved away from buildings with windows over the last 30 years and suddenly realized that having a window you can open is a really good thing when air quality is an issue. So I think, you're going to see that buildings with windows start becoming more popular again. But we're going to do everything we can to be as safe as we can and to make sure that everybody who comes on that campus is vaccinated and has the least chance possible to catch or transmit the disease to anybody else.
Seal, any closing remarks on behalf of the Historical Society?
Well, I just want to say that thank you for having us on your show, Mayor Bolwidge, but also I want to say that we will continue to try to bring information to our young people, and hopefully we can play a small part in helping them to see what the future holds and how it connects to the past.
Seal, I want to thank you for being on the show. Ms. Seal Mantilla, who's the president of the Historical Society, thank you very much. And also to Mr. Mike Simon, thank you for your legal perspective and all of your work on the Historical Society. And also, Dr. Donovan, it's good to see you again. I hopefully look forward to seeing you next semester on campus at Kean University, and appreciate all three of you taking the time out of your schedule to join me on this show.
Thank you, Mayor, and thank you for your leadership.
Thank you, Mayor. Appreciate it.
Thank you, Mayor.
This is Mayor Chris Bolwidge. We'll see you next week on another edition of Our City.